Good morning, Isadora.
Good morning, Linda. Nice to meet you.
Nice to meet you. Our rector, Jenny Wilder, she is off today, so she has asked me to be the co-host.
Oh, awesome.
So everybody could get in.
Great.
Good morning, Alvy. Are you there? Not yet. Good morning, Dale. That's like me. I usually sign in and then go and get my cup of coffee.
Yeah, I do the same. I think I've been sitting here probably from 9 in the morning, just making sure
I
that
know
it's gonna work fine.
Good
this
morning,
time
everybody.
is also. Good morning, Alvy.
Good morning, Albie.
Good morning.
How are you?
I am good. I'm like Linda. I'm trying to finish getting ready this morning.
It's Sunday morning and then daylight also, so
Yeah, I lost my hour of sleep and my body is like, what did you do to me?
I'm feeling it. I'm feeling it too.
But
Yeah,
what we lose in sleep, I gain a very long sunsets, which I love. So it's a win.
It was nice to wake up and it was so bright outside. So, yeah.
Yeah, that's definitely going to help me in the mornings when I'm taking Alexandra to school and it's like 6 a.m. and it's broad daylight.
Well, actually, I'm going to go run and get one more cup of coffee. So I'll see you all in just a minute.
Grab your coffee, everybody.
Yeah, Isadora, will you need to share the screen or anything? You're muted.
There we go. I'm fine. I will be sharing my PowerPoint presentation. I'm pretty familiar with the Zoom app.
Okay. One participant can share at a time. So that's checked in the share screen. So that should work.
Okay.
Okay. Good morning, Mary Lynn. She's probably getting coffee too.
So Linda, may I ask you, we were a bit confused. Will I be sharing the time with other speakers today, or it's just me?
Just you.
Okay.
That's a good question. Yeah, that's a good question.
I prepared for it, but I don't know why Julie had mentioned to us that it might be, a couple of speakers on the same day. So I thought, oh, well, maybe it's a short presentation.
No, it's a 6-week series we're hosting, and there's a presenter each Sunday. Started last week, and we'll go until Palm Sunday.
That's great. I love it. I was looking at the schedule. It looks very interesting.
There's a lot of great work being done in the city, and we need to figure out a way to tap into it.
Definitely.
And City with Dwellings is now you're with Yeah, city with dwellings, right?
Yeah, correct.
Yeah. Good morning, vestry room.
Good morning.
Wasn't sure. You guys
Hi, we're still trying to figure out how to get our video on right now, but we have audio. It's good to be with everyone.
We can see you.
Mm-hmm.
Yeah, your video's on, you guys.
Good. We just can't see
Okay, never mind.
Okay.
Well, we're going to give everyone about another minute or so to get logged in. Thank you guys for coming. We have another great session coming up today, because if you think you enjoyed last Sunday's, today's is going to be probably even better.
I hope so.
I know so. I am naming it and claiming it, my friend.
Good.
So just a few housekeeping rules, which, like I said last week, being in this whole Zooming and rooming world, we should know these by heart, but please remain muted during our session. We shall reserve time just before we wrap up for any questions, comments, answers, statements of love and hugs virtually. Just before we wrap up, you can either place your comments or questions in the chat space or raise your hand if you're there at St. Anne's. And we'll be getting started very shortly. So welcome and thank you for joining us. All right, well, we're going to get started because it's about 2 minutes after. Welcome, everyone, to Building Bridges for Justice, for Equity, Justice, and Community, our St. Anne's Outreach Lytton Adult Formation Series. We are in week 2, and we are happy to introduce our a wonderful representative from our community partner at City with Dwellings. And okay, forgive me, I have been practicing to not mispronounce your lovely name.
You'll be fine.
So forgive me in advance, everyone. But Miss Isadora Galindo, did I do it right? No.
Cordito.
No.
Yes.
Cordito. Okay. Like I said, I have been practicing.
Don't worry about that. I will be.
But
go ahead.
But her bio, which can be found within a link to our church newsletter, is, if you have not read it, it is absolutely fascinating. Like, seriously, if you ever take time to write a book about your life, I'm going to read it. She lives here in Winston-Salem, but this is not, you know, she's not born and bred here like yours truly. So I'll let her, you know, gush about her life, because I do not feel that I could ever do it justice. So please welcome Miss Isadora.
Thank you, Albie. I'm delighted to be here this morning with you. Like Albie said, I am from Venezuela. You can hear my accent, even though I've lived in the US for about 20 years now. I initially lived in DC for about 18 years, and I worked for the World Bank for a decade. We were just helping different projects in different areas around the world. I had the pleasure and the opportunity to work in Latin America, work in Europe, work in Africa. So it was a very fulfilling job. A bit crazy. DC life is not easy compared to around here. But I really enjoyed it, and it was a wonderful opportunity to meet people from around the world and just really be exposed to a lot of, world issues. So I got married in 2019, and my husband and I decided to move to North Carolina, and here we are. I'm pretty new to this role that I am right now at City with Dwellings. I started last year in October, and I am the guest and volunteer relations specialist. And I will be pretty much telling you guys about what we're doing in the city to build a community to end homelessness in the Winston-Salem and Forsyth County. So like I said, it's a pleasure to be here with you on Sunday morning, and I hope that I cover most of the information that I kind of expand on what is already on the website, and I will be talking a little bit more about the program that I oversee and that I manage at the community center. So I guess I will go ahead and share my PowerPoint presentation. Let me just do that quickly here. Oops, can I share my presentation? I think I need some kind of right.
Yes, Linda, because you're the host, can you make Isadora a co-host, and that way she'll have the ability to share her screen?
Linda, you're muted.
We did multiple participants here, so hopefully see if that works.
Okay, let me try that.
Okay.
Yeah, I think it's working now.
All right.
Thank you, everyone.
So we are going to go to the beginning. Okay, so here's the PowerPoint presentation like I mentioned before. So we're going to dive in directly into our first slide. So I would like to start by sharing with you 5 facts about homelessness. First of all, we have fact number 5. So did you guys know that you can fill 5 football stadiums with the U.S. homeless population? According to the Department of Housing and Urban Development's annual point-in-time report, this point-in-time report, it's a report that it's done on a given night. This particular data comes from 2020, January 2020, and at least 580,466 people were considered homeless in the U.S. Half of the population was reported in California, Florida, and New York. Also, the report showed that 9,280 people were homeless in the state of North Carolina, and 504 were homeless in the county of Forsyth. So at City with Dwellings, we usually see at least 180, perhaps 200 of these 504 that are in the county. And most of these people are unsheltered, and they're living either in the streets, in cars, parks, encampments areas. So these are not places for them. And we also serve a population that is at risk, and it's at risk of losing their house. People that might have been behind in rent, now they will be evicted. People that are victims of sexual or domestic violence, that they have been, living in their houses with their families, and now they have to leave the home to be in a shelter. But not all the shelters have capacity to fit all of these population. So now we're going to talk about fact number 4. This one is pretty much 37% of people experiencing homelessness lack shelter. So when we talk about that, we're talking about roughly 200,000 people in the U.S. that are sleeping outside in the streets or in spots that are not meant for living. Among who are on their own, half do not have shelter. There is a significant increase that was reported by the National Alliance of to End Homelessness in the 2021, I believe, report that was done. 30% increase was noted between 2015 and 2020. Unfortunately, the data comes a bit delayed. We don't have right now anything from 2021, but hopefully that's some information that we can always post in our website. About fact number 3, being homeless could take 20 to 30 years off your life. That could be shocking when you see that at first. But for us that are working with this community that it's so vulnerable, we can see why it's a true statement. Our people are facing a variety of struggles. They are more likely to get sick. They are dealing with mental health issues, also substance abuse, and most of them are also victims of violence. For our fact number 2, we have Winston-Salem and Forsyth County is short 16,000 safe, affordable housing units, more than the seating capacity of our LJVM Coliseum here, where most of us probably have been to for a concert or a basketball game or some type of performance. So it's really it's frustrating when I see that number, even though we are aware that that's what the city needs in order to provide a safe and stable place for our community. We're all working with different partners, working with different, we're all working with different partners and agencies, trying to connect our community with different resources and different providers that somehow will have access to an affordable housing option for our community. And the very last fact is that anyone could be a homeless. And a lot of people say, oh, no, I will never be a homeless. Anyone really can be a homeless. There are thousands of people in the US that live paycheck by paycheck. And anything as little as it can be can set them back. So again, if somebody loses a job, so cannot afford to pay the rent, they get evicted, now they're homeless. They can be victims of scam. We've had a family that came to our center not long ago, and they were thinking that they were leasing a property from this gentleman that happened to be a scammer. And so he took all their savings, they were left with no money, and now it's a family of 5 and they became homeless overnight. So it's really, it can be a very sad picture if we think about all of these together. But I think the community, the city, the state, we're all doing our part to bring hope to our community, hopefully, and I'm very hopeful all the time that we will be able to address all these issues. And it's not only homelessness, but it's the mental health, it is education, it's just a compound of different factors that I think are very important for our people to go from being homeless to being housed. Okay, so now you're probably wondering, who's that anyone? So pretty much this is the type of people that we see at our center. We see single adults, we have families with children, we see some veterans. The most vulnerable. Who are the most vulnerable? The most vulnerable are those that are unsheltered, that are have any disabilities, and then the youth and the young adults. In the 5 months that I have been at the center, I don't think I have met many people underage that have come through our doors looking for help. I would say that there are a lot of people that are in their early 20s, I want to say, that are dealing with homelessness. There are maybe foster kids that have grown up, within the system. So that's pretty much what we see at the center. Then you would wonder why. Why are they homeless? Well, these are some of the reasons why they become homeless. Personal hardship, lack of affordable housing, unemployment. They're working, but they're still living in poverty. They are victims of domestic violence or sexual abuse. They are dealing with illnesses, addictions, or any disability, and lack of trustworthy relationships. This is where City with Dwellings comes to play. So City with Dwellings pretty much was created in 2012 with a group of organized volunteers that realized there was a need in the community for winter shelter, an emergency winter shelter. And that kind of evolved many years later. In 2018, they became a nonprofit, and now with a program and different teams that are really what they different teams that are part of each of these programs. They are just really trying to build a supportive, sustained community with the individuals, connecting people, like I said, to resources and different ways, because the center really opens its doors for people to be able to feel safe, to have a place that is safe for them to come in, spend some time. They can do several different transactions, like I call them. They can come in and get assistance applying for vital documents like social security cards or ID cards, birth certificates. They can get assistance with housing. We connect them with case managers, social workers, and then of course we offer the winter shelter that it's about to end this month, end of March. And the rapid response housing that is also part of City with Dwellings. I want to show you a map that I think it's really neat, that was put together, that shows where City with Dwelling has an intervention and how City with Dwelling supports the individual that navigates, okay, the whole system. So here it is. It's called Homeless Service Systems Map. Pretty much City with Dwellings is trying all the way from the front door to the back end. So for this map is, you will see the steps that are circling red. It's where City with Dwellings has an intervention. Okay, that's where we are involved in the work that is done. This, as you see, is not a linear process. It can be convoluted, it can be circular. If something happens halfway that sets you back, you might have to start over. Or you are again stuck at a step, you're not moving forward. Applying for housing, getting a housing in this city is very difficult. Very difficult. A lot of our people put their names on lists for different apartment buildings, complexes around the city, and it can take years for this person to have access to an apartment. So, for example, City with Dwellings, the team, the outreach team, usually coordinates the work between us, City with Dwellings, and other agencies. They also connect the individual with community resources and provides the necessary support to the individual that is going to be transitioning between homelessness and housing. That's that. Okay, so one thing that we always talk about is how our programs are designed. And we think that we provide a person-centered service. So you see, this is just an example that we're going to use just a name. Molly, for example, she's in the center. We at City with Dwellings have 3 different major groups. So we have the Community First Center program where we provide resources, support to Molly or people like Molly. Then we have the Diversion Street Outreach team that is always going to prevent that people are sleeping in the streets or are on shelter, or at least if we cannot prevent it, at least we can help connect them with the local shelters, for example. Or if that person has a family member or a friend that is willing to provide shelter for that night, that person is not going to be in the streets. The overflow shelter, it's just obviously offered during the cold months of the year. It's usually from December 1st through March 31st. This year, I understand that there has been an agreement to extend, because initially we planned for the shelter to be open between December 15th and March 15th. But I know there has been a new agreement, and the women's shelter will be open till the end of the month of March. And the men's shelter, I think it's closing on March 15th. And then we have our daily operations, where we obviously have a board of directors, we have our volunteers, and our community. So you see there's an overlap. We cannot do one thing without the other group or the other service. And we couldn't do any without our people, really. Our volunteers and our people are really what runs this place. So a little bit story about Molly. Molly was homeless before the pandemic. She was living under a bridge. City with Dwellings came and helped her navigate the pandemic, her homelessness situation. She was placed in a motel where 50 more residents, if I'm not mistaken, were moved to spend those months of winter. So Molly was receiving on a daily basis different kind of support. We had people that were that City with Dwelling partner with that were providing meals, were providing peer support. So all of these comprehensive services that she was getting really help her go from being homeless to being housed. And during that stay, all of these residents were learning how to function in a independent way, to learn different skills, how to manage finances, how to set goals, how to set priorities, that kind of stuff. And just be, what we want is our community is in control of their own health and their own stability. That's our goal. I want to play a video, and I hope it's going to work out. This is Lee. Lee was one of our guests at the hotel before the pandemic. Yeah. And unfortunately, Lee passed away later on, but it's a very nice experience just to hear his story that I wanted to share with you guys. So let's see if this is gonna work out. Okay, let me, let's see how we do this. I'm going to stop the sharing here. I'm going to go to my internet. I think this is going to work. And here we go. And let me know if you cannot hear it.
How y'all doing? My name is Lee McKee. I just want to share a little bit of my experience being homeless and now being here at the hotel. You know, when I was homeless, I didn't know where I was going to sleep. I was drinking every day. I was really destroying my body and my mind because I was just using, you know, didn't have nowhere to stay. The last day I stepped on the back wall by Crystal Tiles outside. You know, it was raining and stuff like that. It was doing bad. You know, this hotel and City of Dwellers, they came to me to help me because I didn't know where I was going to get help at. I was stuck just out there using. I thought that was the answer, just keep drinking so I could suppress my feelings and the issues I was going through. But, you know, when they came to me just going to the hotel, I was telling some of my friends, this is like a godsend because I didn't know which way to turn and which way to go. So it was like godsend. God answered my prayers while we would, you know, have anything to do with it. You know, I was telling four of my friends I used to hang with every day. Me, a guy named Terry, Chris, John, and Henry. I said, man, God snatched all us up and put us in this hotel at the same time, almost the same day. Matter of fact, John came a little after, you know, and we hung together every day. So I know God has something to do with this. You know, I'm happy to be here. I'm blessed. I haven't drank any alcohol for 5 weeks. You know, I'm feeling better. I'm doing better. Everything going on. Everything is going well. And they're trying to work on housing for me when we do have to leave here. You know, and that's a blessing because I didn't know how I was going to do this thing. They told me today they was going to help me reapply for my food stamps. You know, help me with my disability. You know, get my ID, my social security cards. This thing that if I was out on the street, I would have took time off and didn't do. You know, so it's been a blessing, you know, and everything happened for a reason, and you know, and I'm happy because I couldn't have did it by myself. I just couldn't. I wouldn't.
Okay, now we're going back to the presentation. Let's see. Okay, here we go. So my next slide will talk about the 4 big programs that City with Dwelling has currently right now. The Community First Center, it's kind of my baby because that's the one I oversee. And I will talk about that in a few slides, more in depth. The Diversion and Outreach is basically a program where our staff partners with community health providers and first-time responders to fill in the gaps between the system of our vulnerable and sheltered neighbors. We provide transportation. We set reminders for appointment reminders. We can take people to different places like food pantries or closet pantries. If they need to move from one place to the other, we can provide that kind of service. And the overflow shelter, I already talked a little bit about it, but mainly, and that's, I always like to emphasize that, is that the homeless community, our community, is it's very challenging. And some of the members are either banned from places, they don't want to stay in the shelter. So it's not so black and white that anybody would say, well, there's the shelter, they can stay at the shelter. No, it's not it's not that easy. They need to want to be in the shelter. And of course, their behaviors, their mental health, sometimes it's kind of a barrier for them to just be part of the year-round shelters like Bethesda or Samaritan. A lot of people cannot go there. They're just banned. They are not allowed. And they don't have any other option during the months that's very cold. So this overflow shelter option, it's really good for them because City with Dwellings is a low barrier community. And for some reason, we see a lot of folks that when they come through our doors, they're behaving. They're just being themselves, but they're not creating trouble or disrespecting staff so that's what the overflow shelter really does. It's a great option there is for our community that are especially not allowed in other places. And then the Heart Support Housing is just a pilot program that offers apartment units in a building. And this is a project that was sponsored by City with Dwellings and United Way. And what do residents receive is pretty much consistent, supportive services and resources. They also have a peer support specialist that lives in the apartment complex, and they have 24/7 assistance. And pretty much the peer support specialist, what this person does is just to be there for whenever there is a crisis, for whenever he's needed. He can teach the residents basic living skills, like I mentioned before. They can learn how to navigate finances. They can do grocery shopping, listen to them when they need it. That's pretty much what the person does that lives permanently in this building where the other residents are. I believe there's only 4 units right now, and like I mentioned, it's pretty new. And so, as usual, everything depends on funding. And I hope that this is something that it's going to grow, and there's going to be more units for the very vulnerable people that we serve. Okay, so now I'm going to talk about the Community First Center. That's one of the 4 programs that are part of the City with Dwellings. The Community First Center is just a community center that it opens doors 3 times a week. It's Tuesdays, Wednesdays, and Thursdays here at from 9:30 to 11:30. What happens during open hours? It's 2 hours where an individual comes through the door. We have a mailroom. They can send mail and packages. We have a technology area where they have access to computers, check emails, apply for jobs, or apply to different services. They have just an engagement area where we serve coffee, pastries. They can come, read the newspaper, obtain or apply to obtain, like I mentioned, social security cards, ID cards, birth certificates. They need to be connected to different resources in the community. And I am in charge of making sure that the volunteers are taken care of and that the space is ready to welcome our guests. We usually, on a typical day, we may see 50, 60 people. Of course, it depends on how the weather is. If it's a hot day, if it's a rainy day, if it's snowy, that can vary. But that's what open hours is for. Then we have once a week, we have Housing Huddle. Housing Huddle is just an opportunity for us to sit down with a limited amount of people and help them with their housing issues. We provide a list of properties that they can apply. We help fill out applications, put together, all the documents that they need. If they don't have one of the documents that is needed for the application. We help them with that, submit the request for birth certificate or social security cards or ID cards. A lot of people have ID cards that are not from North Carolina, and that's a requirement to have a North Carolina driver's license or ID card to apply for housing. Then we have this wonderful foot clinic that I love. We just had one yesterday. This is in partnership with Wake Forest School of Medicine, and pretty much it happens once a month. And we open the doors at 9 o'clock for usually about 15, 20 people. Yesterday, surprisingly, we had almost 30 people that came through the doors. They got new shoes, they get fitted, they get to see a podiatrist. So it's a great service that we're offering for the community. We're hoping that maybe later this year or early next year, we're going to have an eye clinic. And so that will be another clinic that will be added to the weekly or to the monthly programming. And right now I'm working on lining up an art program. I understand that there was an art program in the past before we became a nonprofit. And I'm just looking for volunteers, people that have experience dealing with, this type of community. And that's something that eventually will be added to the weekly programming. It'll be once a week on Tuesdays in the afternoon. Okay, I'm coming towards the end, but wanted to mention that there's several opportunities for people to volunteer at City with Dwellings. We still have these roles because that's kind of how the center is designed. We have a big room where we have the engagement and the hospitality. Then we have a mail room. Then we have the technology area. And then we have a program volunteer. And so basically, what would you do if you are a volunteer for any of these roles? Engagement and hospitality, just make sure that we have coffee, that we have everything ready for our folks to come in and feel like they don't have to worry about anything. Everything is already there for them. Tables ready, chairs are ready, masks, hand sanitizer, if they need to use a microwave, that kind of stuff. We have water, etc. The mailroom volunteer pretty much receives the mail that comes every day and organizes, sorts it out, make sure that the person receiving is still alive, it's still one of our members, didn't change address. That's the kind of things that happens happen at the mailroom. The program volunteer, it's a volunteer that is, it's more, let's see, a program volunteer, it's a person that has a skill set that can be aligned to the program that is the person is volunteering for. If, for example, we had a volunteer that she was great navigating Medicare, Medicaid, Social Security benefits. So she would most likely will be helping people in that lane, doing technology, because pretty much all of these things are done online. So that would be kind of a program volunteer. Someone else that would be helping during housing huddle will be someone that feels comfortable filling out applications, searching for properties, reaching out to leasing offices, and making sure that landlords want to work with our community. Because not every landlord wants to work with our community, and that makes it another challenge. Okay, why volunteers matter? And you see, I get excited when I talk about my volunteers because I am very grateful. I think volunteers are the silent heroes of a lot of organizations. I've been a volunteer myself in many occasions, and I'm sure most of you or some of you have or are currently volunteering for an organization. And I think there's so many benefits for the organization, for the person receiving the service, and for the volunteer that I would just love to go over the things that I personally have experienced myself being a volunteer. So of course you can change someone's life. That's very rewarding. You can raise awareness about a cause in the community. You get personal satisfaction. You bring a fresh perspective and a unique skill set that you share with your peers and with the staff. You're giving back to the community. You feel rewarded and fulfilled. And I think the one that I appreciate the most is how being there working with specific groups changed the perspective I see, my own situation, and how many times we take things for granted. And then you see this group of people, in this case, the homeless, or where I used to volunteer before in Greensboro for the refugees. You see how always the grass is going to be greener on the other side. So it makes you really be more appreciative of what you have when you are in this role. This is my personal kind of perspective, but I'm sure that City with Dwellings also sees how great impact there is when volunteers are part of projects. And of course, we couldn't do our job without our volunteers. That is for sure. How can you help? If you would like to help, you are always welcome to visit our website. You can sign up for volunteer orientation. It's once a month. It's the third Monday of every month at 2 p.m. It's a very brief orientation. We just go over the do's and don'ts of a volunteer, what we do, a little bit more in detail. And there's some forms that need to be signed, like confidentiality agreements and performance issues, that kind of stuff, but nothing too complicated. Of course, you are also welcome to give monetary donations. And of course, I always tell people, visit our website when you have a donation. Why? We get a lot of donations, or people that want to donate items that unfortunately we don't have the space or the hands to sort, to organize, keep it, kind of control. So we're always going to need something. Right now, probably we're in need of coffee, sugar, creamer, but maybe next month it'll be reading glasses, or it could be running shoes. It just depends on the need that the organization has. So we update that list constantly on our website, and that is always the best resource to do before bringing anything or engaging in collecting some items that at the end are not going to work out for us because we're not going to be able to organize it or keep it in the space. And we don't want to duplicate services. If we have Greenest, we have Restore through Habitat for Humanity, or we have Salvation Army. Everybody does something, and everybody handles donations differently. So we just want to make sure that instead of us having to create a closet pantry, for example, bringing more hands to keep it organized and keep it sorted and make sure that the donations are really, in good condition, we just rather you take that to somewhere else where they're going to have already a system and they're going to be able to manage their resource. And of course, there is this QR code for the tech savvies. You can always go there and it will take you directly to the page where you can donate make monetary donations. This is going to be the end of my presentation, but I wanted to close with showing this slide. Some people may think we, the people working for the homeless, are naive, thinking that we're going to end homelessness in the world or in our little county or in our city. I want to believe that we're going to be able to do that. I don't think homelessness is really the problem. There is a bigger picture, and homelessness is just a symptom. There are several systemic failures. There are many different factors that contribute to a person becoming homeless. So I just want to close this by saying that in the meantime, while we are hoping that we're going to end homelessness in our town, we're going to continue working on building community and center services for our neighbors that are experiencing homelessness. And just remember that all of these different issues, addictions, disability, lack of housing, domestic violence, all of that is really what creates or leads somebody into homelessness. We as an organization are now working towards becoming more trauma informed, and not only us as organization, but also making sure that we build a resilient community, so we can together work for a better future. So I just want to say thank you to you guys for having me today. I really enjoyed my presentation. I have to say that it's my first speaking engagement outside the four walls of my community center. So I was very nervous, but I'm very glad that I was given the opportunity, because it's very important that people know what these little organizations, are doing to just make, a better world. We all want to have better communities, and I really hope that with this you go home knowing that what we do, how you can be part of, and how can you help.
Thank you, Isadora. That was a wonderful presentation. Wow, I learned a lot.
Yeah, that's a lot of information.
Yeah, and seeing those numbers just reminds me of back during our Advent outreach project that we had during the holiday season, or at least prior to it. I did some research and on the statistics, if you will, for homelessness, both here in our community and across the nation. And when you presented those numbers, it just flooded me right back to that. And during that whole time of doing all that research, all I could do was just shake my head and be, I was upset, pissed off, upset, mad, frustrated. Mm-hmm. Pick an adverb and an adjective and insert here. And I'm eternally grateful for the plethora of organizations, including Cedarwood Dwellings, that is working on the ground, maybe even underground, to try to combat homelessness, especially here in our community. I've lived here for over 4 decades, and I swear within the past two, I've seen homelessness in this city, in this county, get worse. And that's within just the past 2 decades. So imagine what was the 2 decades prior. But I'm grateful for organizations like Cedarwood Dwellings that is working tirelessly to help reduce the number of homeless people that we have here in the city and the county. And it breaks my heart even more to know that there are children within those numbers. So if anyone has any questions, comments, or discussion that they would like to share, feel free to place that either in the chat space, or if you're at St. Anne's or in person with us today, just raise your hand and we'll be happy to get the discussion started.
Alvi, before somebody sends a question, I wanted to mention that our center is open all year round. It doesn't matter what's going on, if it's Easter, if it's holidays, we are open the whole year round. We're actually going to be having sometime in April, the board of directors has given us a week off. And we are going to be at least opening those weeks, the prior and the after the Holy Week. At least we're going to open so people can get their mail and, do basic, transactions. but we cannot just shut down. I mean, it's just it's amazing how you go to the center on a Friday. As soon as you park your car in the parking lot, people start coming. They know you're in the building and they need help, and they knock on the door, and they're always expecting that you're going to be, helping them, even though we're closed on Fridays. But it's just, it's a big, work that we're doing there. And I mean, I have my little program, but the outreach people, I take my hat off. They work, I don't know how many hours a week, Saturdays, Sundays, mornings, late nights. I mean, it's just, it's really inspiring, I want to say.
Yeah, thank you for that. Does anybody have any questions, comments, or discussion? Linda, I see your hands raised, sweetheart. Linda,
yes,
baby.
yes, I'm here. Yeah. First, thank you. Let me lower my hand. Thank you, Isadora. That was really informative. I appreciate your time. And I really appreciate your last comment about the systemic issues, which actually is what the problem is, that creates homelessness. And there's, one of your sister organizations, the Experiment in Self-Reliance, has been in this city for over 50 years. And in fact, St. Anne's in the mid-60s was part of what helped create the Experiment in Self-Reliance. But we still have the problem, over 50 years of supposedly trying to address it. Do you see, is it we just clearly our community doesn't have the will to end it, is what it seems, to do what it takes to end it. Do you have any signs of hope within the power, which is really funding in a lot of sense, with our city and with our county to try to address this more seriously than we have in the past?
That's not my, expertise, but I've had somebody that has come to the center that wants to volunteer, and she is involved in some political efforts, and I don't know, it gives me the impression that there are a lot of people that really want to help and really want to make a difference. And I know that, our executive director is just working relentlessly, looking for funding and partnerships and, whatnot, to really keep our doors open and to keep providing the services that, we've been providing for the past, 10 years, even before we really became a nonprofit. So I would say, yes, there are, we're making a lot of efforts, and I think there are sections within the state or the county that they really want to, make a difference. But then again, it's not only them. We need so many other parts, team members of so many different places to really be building units. We need housing. We need that desperately. Our people cannot afford rents that are beyond $1,000 some. That's way too high for our people. We need, resources to handle people with addictions. We need resources for people to, that has mental health disorders. I mean, all of these things, they don't get addressed. You're back to square one, so I want to say yes. But I think there's still a big chunk of people in the society that, I don't know, maybe, they have lost hope. I hope
Oh, thank you.
Answer your question.
No, you did. Yeah, thank you. Thank you. They're glimmers, but there's still a lot of work to be done. It seems, right. Thank you.
Thank you. Does anyone else have any questions, comments, either here in Zoom or in person? Anybody?
Well, let me just ask, what happens when someone leaves your program? Do you keep track of them? Do you have a social worker who follows up, or what? I may have missed your initial presentation. So.
Oh no, that's fine. Well, they really never leave. That's the beauty of this organization. I have seen people gone from being homeless to housed, and they still come to the center to, either check their mail, they come in and use their computers, they come in and talk to our outreach team. How do we do this? How do I get there? So we keep connecting them. They're not left alone when they get housed and, oh, bye, see you later. No, we do follow-up calls with them. We do keep track of them constantly. The outreach team does all of the tracking for our guests. So they really never leave. They participate. We have our sister organization, The Dwelling, the church, and through The Dwelling, we see, or they actually see, a large amount of people that probably don't come to our programs in the mornings or to Housing Huddle because they are already housed, but they still participate in the community. And so I think there is it's something that, really gets me, is how much a connection there is between the individual receiving the service and then with the organization. I mean, most of our guests have known our outreach team for years. There's people that they've known for 7, 8, 9 years. I'm pretty new to this, but it's amazing how the trust they develop with this person, the confidence. I think that's what I like about this place the most, that it never ends. Even though you're now independent, living on your own, in your apartment, they keep coming to us for advice, for support, you name it. So yeah, we do all the connections with case workers, social workers, case managers. So yeah, we're always really connected to our community.
Thank you.
You're welcome.
Well, and I want to say what that seems to address is that need for community and neighborhoods, which, the neighborhoods in East Winston, we all know now historically were destroyed with highways and so forth, and never really regained that sense of neighborhood and community. And so that longing that we all need for a sense of community that you all address. So thank you for that.
Yes, thank you. And before we wrap up, do we have any other questions or comments? Thank you, Isadora. This was amazing.
Thank you, Albie. I try my best.
Oh, you did a wonderful job, sweetheart. Beyond anything. Like, I'm once again left speechless.
Yeah, I just want to tell you guys that most of our volunteers are retirees, but we also have weekly, we count with med students who are coming on Tuesdays and Wednesdays for the whole 2-hour window, 9:30 to 11:30, and they are providing, help making appointments, talking people into maybe getting a primary care physician, not going to the ER for regular visits, helping them with Medicare, Medicaid questions that they may have, or calling the pharmacy to fill in, a prescription. So it's a really, the group of volunteers is very diverse, and which is something that I really like. So we have people that come with so many, different skills, experiences, that they all contribute, in a way. to the work we do. So our community, our guests are very grateful for, the time that the volunteers spend there, talking to them, listening to their stories. I mean, I'm not supposed to be, because my role is more of a volunteer coordinator during those hours, but I'm not supposed to be, working directly with the guests. But when I don't have any volunteer, I'm the volunteer. So I'm wearing different hats when needed, because that's the work of the nonprofit. You cannot just do this thing. You need to do other things to make things happen. But it's great, the work that our volunteers do. And if anybody, ever wants to join us, like I mentioned, for orientation, you're more than welcome to reach out to me. My email is at the front was at the front of my presentation. And of course, you can always reach out to Alvi, if you need to get in touch with me. But everything will be, all the details about the organization will be on the website.
Thank you. All right. Thank you again, Isadora, for your wonderful presentation. And thank you all for joining us for another session of Building Bridges for Equity, Justice, and Community. This session has been recorded, so give it about a day or two, and you will be able to rewatch this along with last week's session, just in case you missed it, on our St. Anne's YouTube page. I placed the website for Setting with Dwellings in the chat space, so please find some time, utilize your talents, your heart, and take the sweet, sweet spirit of St. Anne's out into the community so that we can start the long marathon journey of chiseling away at the systemic issues that plague our community. Thank you again to Isadora. This was wonderful. And thank you all for joining us. And I hope to see many of you at our 11 a.m. service starting soon. Thank you, everybody.
Thank you.
Bye.
Bye.
Thank you, everybody.
Bye.
Thanks for having me.
Thank you.
Bye-bye.
Bye.